310-8789. If you're a Tottenham Hotspur fan and your heart's broken, call in tonight. Dr. Luhar can give you a tonic. No, jokes aside. I asked you the last time when it came, because I remember the question. I said, so what is naturopathic medicine? And you told me that we treat people, we don't treat diseases. And, that in itself stuck with me, because some forms of, some disciplines in medicine, go out of their way to treat the disease, treat the effect. Some don't even treat the cause, but you're treating people. So if someone is listening tonight and they have no idea what is naturopathic medicine, apart from the fact where you treat people and not just diseases, what is naturopathic medicine?
Well, firstly, I'm really glad that that point struck you and that you remember that, because that was a long time ago we spoke about that. And what's interesting is 16 years later in practice, I've been in practice, this is my 16th year,
right,
and I still stay as true as possible to these underlying core principles of naturopathic medicine. And so the main principle, the main distinguishing principle is that we are looking to uncover the root cause of disease. We believe as naturopathic doctors that the body has an innate power to heal itself, and if you give the body the right nutrients and the right support, you will be able to restore function and physiology and then attain the vitality to be able to basically reclaim your health. So we're doing that using natural therapies and natural medicines because we come from nature. So of course, if we're using natural substances and natural medicines, one of the nice things about that is that we're not introducing chemicals that will have toxic effects on the body, and the body is able to recognize these natural substances and it's able to actually respond to the natural treatments and restore health.
So, all right, so what type of, when you say natural treatments, right, you're talking about plants?
Yes, plants. So, in my practice, I'm doing a lot of different things ranging from plants, orthomolecular medicines, vitamins, minerals, all of these kinds of things. I do a lot of Chinese medicine. Acupuncture is actually 80% of my practice. I use acupuncture from everything ranging from digestive problems to hormonal issues to even depression and anxiety.
Wow.
But one of the main cornerstones of my practice, and this is something I do with every single patient, is I look at their diet, because for me, food is your medicine or it's your poison. And if a patient is not willing to actually change what they're putting into their body, then unfortunately we can't go as far as we'd like to go, because what you're eating is going to eventually become a part of your liver or a part of your skin or a part of a brain chemical. And so food is a big part of that therapeutic principle.
And a doctor of naturopathic medicine shouldn't be confused with a homeopath, right? There's a difference between a naturopath and a homeopath.
In many ways, they're very similar. So in my Canadian training, there is a distinction in that most of the homeopaths in Canada are classical homeopaths. So they're using very, very, very dilute, medicines coming from plants or animals or minerals to be able to get the body to respond and come back to health. Whereas in South Africa, most of the homeopaths actually practice very much like naturopathic doctors and are using other types of modalities, even Chinese medicine and acupuncture.
So, Dr. Luhar, when you look at your patients in Dubai and here in KwaZulu-Natal, what would be some of the more common ailments that patients are presenting themselves with when they visit a doctor of naturopathic medicine?
It's interesting that you actually touched on one of the big ones, which is diabetes.
Right.
So type 2 diabetes is, definitely type 1 as well. And all of these sort of inflammatory disorders, so whether it's heart disease, high blood pressure issues, weight gain, and then I'm starting to see a lot of things related to the liver, so hopefully we'll touch more on that with fatty liver. But I'm also seeing a lot of hormonal issues, so thyroid disorders, female hormonal problems, whether it's the transition into menopause. And another thing that's coming up quite a bit in the last 5 years for me, not just here in KwaZulu-Natal, but also in Dubai, is fertility issues.
Okay, so it's a wide range, really,
yes,
of different ailments that patients are presenting themselves with. And naturopathic medicine, it's safe, right? People shouldn't be overly concerned.
I would say that it's safe, but it doesn't mean that you can just willy-nilly, self-prescribe. Yeah. And that's what a lot of people do. They go to Dr. Google,
right,
and then they find something that they think makes sense for them, and they take it. But, what's really important in the world of natural medicine is the quality of the natural medicines, and whether you're taking a therapeutic dose to get a therapeutic benefit. So while it's safe, a lot of plant-based medicines still need to be respected. There can be many interactions.
I was going to say that because, some plants are deadly, right?
Yes, absolutely.
So if it says natural on the bottle or on the box, there's some reason, there's this automatic assumption, Dr. Luhar. Oh, well, it's natural, it's got to be good.
Yeah.
And that's not always the case.
It's not always the case, and I think there's just misconception that if it's natural, it's akin to eating a food product. And so if you can eat it, hopefully it's going to be fine for your body. And that is true when it's a food. But when you're taking, medicines that have been extracted and you are taking them in high doses, there are going to be some physiological changes happening in the body. And so you have to be really, really careful, especially if you combine those with your conventional allopathic medicines. And there's no reason you can't do an integrative approach. I'm all for that.
Okay.
But you just need to make sure that both your medical doctor, your naturopathic doctor,
Right.
everybody knows what's going on, because you can have interactions.